everybody, and thank you so much for following up with this brain function series that we're presenting them to you through the Togetherness Media, Los Angeles. Mohammad Nami, I'm a medical cognitive neuroscientist, and I've been privileged for this journey together with you over the past sections and episodes of this series to talk about the importance of the brain function and how that puts together our health, mental health, and well-being in general. We've been discussing about different aspects of brain health and functionality, and then lately we've been talking about sleep as one of the main temples and pillars of our health. So just in the 17th episode, just an episode before this one, we've touched on the clinical significance of sleep disordered breathing and a range of sleep-related problems. And here in the 18th episode, if you would agree, we are going to scrutinize the solutions for the sleep disordered breathing. And when we refer to SDB, or sleep disordered breathing, generally we're talking about how breathing during the sleep, which is an autonomous process, and that is very, very uncommon to be under control. So we do not have quite well intentional control over our sleep, over our breathing during sleep, right? And based on that, we might be facing some breathing issues. So when people have narrowing of the upper airway, when the people have just, insufficient patency of the upper airway during the sleep phases, then they have the limitation of the airflow. So by the turbulence of the air exchange or the airflow through the narrowed upper airway, then the sound like snoring, like a vexing sound of snoring will be the case. But we've agreed already that this is not a funny thing. This is not a sign that someone is undergoing like a good quality of sleep because he's snoring, so probably is deep down sleep. No, that's not the case at all. So we got to quite well understand that snoring is a symptom which might be indicating an underlying breathing problem during sleep. And that might be hypopnea, which is the limitation of the airflow, also apnea. In many of the instances, snoring, the loud snoring, the high-pitched snoring, and witness apneas are very, very critical in people, because when they have this issue, they face with the lack of oxygen delivery to specific brain areas during the sleep, and this is perhaps going to be detrimental as we age. And as we have touched on before, the risk of some clinical issues, including stroke and also heart attack, myocardial infarction, diabetes, and obesity, and hypertension, stuff like that, are significantly increased in cases who are chronically suffering from sleep disorder problem, namely the snoring and apneas. So generally, we're referring to the sleep disorder breathing as obstructive sleep apnea hypopnea syndrome. This means that when we have the episodes of apnea or hypopnea more than 10 seconds, and in an instance that we got like a drop in the saturation of the blood oxygen by at least 4%, then in that case, we're facing a significant sleep-related breathing event. And so when the index for the apnea hypopnea, or the number of the events, respiratory events in an hour, exceeds the number 5 event, that becomes significant, and in many cases we need to go for treatment. Today we are talking about the solutions. So we already understood about the diagnosis of sleep apnea or sleep disordered breathing and snoring, pathological snoring, but now we're going to understand what's next, what we need to do. First, we got to be seeing a doctor. We undergo the polysomnography or sleep test in a certified polysomnography or sleep laboratory. And the certified sleep physician will give us the exact diagnosis. When the critical situation is the case, then or an important clinical situation is there, we need to go for treatments. So first, many other doctors that do specialize in sleep recommend us to follow the sleep hygiene measures, to avoid late night meals, and also all the different, alcohol, and also smoking at nighttime, and all the different measures and recommendations that we already touched on in the earlier episodes about the sleep hygiene. So if we follow that and it does not work, then depending on positional status, where we're snoring in sleep, the doctor might be giving us some sleep position training. This means that some folks, they have like snoring or apnea hypopneas only in the supine position, or predominantly in the supine position. So when they are sleeping in a lateral position, or when they have the head of bed elevation, the risk of snoring and also apnea events will be significantly decreased. In that case, we're referring to the case as a positional sleep disorder breathing, or positional apneas. So all we need to do is sleep position training. And sometimes when we are barely aware while we sleep, we cannot change our position, right? So we might be wearing some specific gadgets, or jackets, or something like tennis ball jacket is an example for it. So these are the things that we have two tennis balls between the scapula, between the shoulders and the back of the back, and by that it would not allow us, although we are barely conscious, but it would not allow us to stay in a supine position, to snow in the belly up position for a long time. So we got to be turning into sides. And sometimes it works, sometimes it doesn't. And based on the situation, then the healthcare provider and the sleep expert might be going for some other clinical measures and solutions, including like changes in the position of the tongue or the mandible. And by this, we're going to prevent the backward positioning of the tongue. So when we have the low lying soft palate, also we have the wide base of the tongue, then there is a risk that these tissues are going to get back together and to collapse the upper airway. So by this, we have the limitation of the airflow, and also we got the apnea episode. So when doctors are helping us to wear some specific oral appliances with the help of the orthodontist or dental sleep medicine experts, so we're like a multidisciplinary team, right? So we work together and we decide together. So we consult the case with the orthodontist or dental sleep medicine expert, and we provide the referral with the wearable oral appliances. So they got this, molding, and then they're wearing this appliance every night before going to bed, and that significantly helps in many instances. Sometimes the maxillofacial surgeons come into play, and we're deciding about wearing or instrumentalizing the patient with specific devices called mandibular advancement devices. So they're just given this like protruded position of the jaw like this. So by this would prevent the backflow or positioning of the tongue and other soft tissue collapse at the back of the throat. So this is one of the other solutions, and it helps in some instances as one of the resolutions that we got. If it does not work, in instances like patient has got to moderate snoring and sleep apnea, and the situation is not that significant, then we go for the medication therapy. Before I'm going to detail the medication therapy, I need to go for the delineation and explanation of two different terms: obstructive sleep apnea, central sleep apnea. So central sleep breathing events refer to the brain. I mean, the brain would fail to send the order of breathing, and the breathing centers in the brain are hypoactive. So the breathing will be ceased for a distinct period of time. We got breathing pauses. And that's not because of the obstruction, because of the narrowing of the back of the throat tissue that we got sleep breathing problem, but that because the brain does not send the signal for breathing. So this is called central sleep events. In that case, we might be going for medication therapies. Some of them are topical medication therapies like inhaler sprays, or we might be given systemic medicines. And in some cases, for obstructive sleep apnea, also we are prescribing such kind of medications to decrease the resistance of the upper airway. And that is also going to help in several cases. And if it's not really helpful, then at the same time, we might be asking our sleep language therapist or sleep language speech language pathologist or speech language therapist. I'm sorry, and they are the SLTs are helping the referrals with some exercises to strengthen the tone of the tongue muscle. So they are giving you some exercises to increase the tonicity of the muscle of the tongue and also the muscles of the jaw and also back of the throat. So these are going to enhance the patency of the upper airway and to prevent the collapse of the airway and the backflow positioning of the tongue. This is one of the other things. Some cases with obesity and in some instances with morbid obesity, with the BMI more than 40, they have no option but to decrease the weight to get cleared from sleep apnea. So we might be consulting with our dietitians, and our dietitian on the board is going to help the subjects with a specific diet advice to go for weight reduction. And if it does not work in case of morbid obesity, sometimes we have no option but to go for the bariatric surgeries or sleeve surgery. And by this, the transit time of the food from the GI tract or the gastrointestinal tract will be changed, and the patient will have the chance to decrease the weight significantly. But taking them all into consideration, the gold standard for the treatment of the sleep disorder breathing and apneas is using a device called PAP therapy or PAP device, which stands for positive airway pressure. So when we have the continuous positive airway pressure device or CPAP device, if you like, we are providing a very, very good solution in many cases. The PAP device is like small, tiny device, and it's connected to tubing, and the tubing is attached to specific masks. So we have different types of masks. Literally, we got more than 15 different types of masks. And the doctor and the healthcare provider is going to decide about the mask which is best fitting for the situation. And then the subject will wear the mask, and also overnight during sleep, the device is going to positively load pressure in the upper airway. So it blows the air into the upper airway, and that keeps the airway open. All right. It's like the engine of the vacuum cleaner that you just reverse that, right? So instead of sucking in the air, it just pushes the air into the airflow, pushes the air into the airway, and that keeps that open. And sometimes we have continuous positive airway pressure, CPAP, which goes for a constant pressure of the air. But in some occasions, we need to go for more advanced devices with different titration approaches for the pressure intensity. We use APAP or we use bilevel, which are more advanced devices of the same family of technology, and that really helps in many scenarios. But still, when the problem is still there, we have even more solutions. So in some cases, we consult with the ear, nose, throat physicians or surgeons, or we consult with the maxillofacial surgeons for a surgery of the mandible, of the denture. The occlusion is going to be, rectified, or in some cases, the ENT surgeon might be doing a surgery which is called UP3 or uvulopalatopharyngoplasty. So they just, take some of the bulky tissues at the back of the throat out, and by this, they will just make the back of the throat less crowded. So by this, the airflow will be more easier. And so these are the conditions. These are the issues that we are facing in the clinical practice of sleep medicine. And these are, and the things that we just touched on are the solutions. And in, roughly 80% of the cases, we have the capacity of helping the referrals significantly. If someone is not aware, is not following up with the issue, is not referring to the healthcare teams, when the situation is left untreated and it goes for a long time, then the thing which happens here is disruption of the harmony and integrity between the long brain axis. Also, it has issues with it causes issues with the heart-brain axis and the lung-heart axis. So imagine that we're just referring to a triangle here: the heart, the brain, the heart, the brain, and the lungs. So this triangle is being dysregulated for the physiological parameters, and that causes significant issues as the patient moves down the road with aging, right? The thing is that many cases with obstructive sleep apnea or loud snoring or hypopneas, they end up with accelerated aging, with advanced early onset dementias or memory problems, with cognitive issues. And the reason behind that is we are facing a challenge of hypoxia or diminished oxygen delivery to critical areas of the brain. I mean, the eloquent parts of the brain that they are, incidentally, very, very sensitive to hypoxia. I'm referring to the area in the front part of the brain, like front back part of the brain here, also in posterior in the back side of the brain here, that we call them parietal areas, and also in the middle, in the mid plane of the brain, we got some structures called cingulate cortex. So these three structures are very, very sensitive to hypoxia. So when we have sleep-related breathing issues and it goes in a chronic state, and we have sleep hypoxia, intermittent hypoxia during sleep, that we might be expecting some detrimental effect happening down the road. So to wrap up, and in a nutshell, what I just want to highlight with you is that what we agreed here is that snoring is not like, it's not a joke. And it's not like a simple, negligible issue. Sometimes it is really, really a clinical red flag. And it's not only a vexing sound, as we elaborated on that. And also, when we are facing central obstructive apnea or breathing issues in sleep, we have solutions. Then we discussed about timely and properly treating the sleep disorder breathing. If it's not the case, then we might be expecting some issues with the brain, heart, and lung axis. And in the long run, we might be facing some issues with a long list of clinical problems. So we know about that, and this is our mission. We're going to pass on the torch. We're going to let the other people, our loved ones, know about the importance of the issue. That's salient, that's important. Do not take that like as a simple thing. Refer and see a doctor, and by that, we hope that the sleep integrity, the structure and the engineering of the sleep, the integrity of and the function of the sleep is going to be there, and by that we're going to have a healthy sleep and healthy wakefulness life. Then we have general well-being, longevity, and also we'll be having the chance of living a better quality and, like a better well-being throughout our life. And I hope that you stay well, you keep safe, and I'm just looking forward to other opportunities that I'll be discussing with you some further issues regarding the brain health and how different pillars and paradigms in our lifestyle and also physiological functions, body parts, is going to positively or negatively affect our brain health. Thank you very much, and we'll catch up later.
Togetherness Media. Togethernessmedia.com